Hi, I'm Nash Whitaker, the Program Director at Iowa Methodist Medical Center Emergency Medicine Residency Program. Thank you for taking the time to join us and learn about our program. Choosing a residency is hard, and we understand that it's a stressful but yet very important time, but the more that you learn about us, I think that decision will be much easier. The faculty here have spent years developing a very unique and exciting residency program. I think you'll be hard-pressed to find other programs where you can rotate at a level 1 trauma center and the very next day rotate through a single-covered, critical access rural hospital where you will get to experience and test the limits of all of your knowledge and skill sets. In addition, we have a very robust EMS and life flight program that residents will get to participate in early in their training. UnityPoint Health has been training residents for decades. So our emergency medicine residents will get to train alongside other residents and build camaraderie and friendships. However, at the same time, they won't be competing with subspecialty residents for patients or for procedures, so there will be ample opportunity for one-on-one teaching. Now you'll be meeting some of the faculty that you'll be working with on a day-to-day basis.
Hi, I'm Dr. Hawthorne. I'm the Medical Director for the UnityPoint Des Moines Emergency Departments. I wanted to welcome you to our emergency department. This is our resuscitation room. I wanted to talk to you a little bit today about our physician staff, the support that we have for the residency, the support that senior leadership has at UnityPoint Des Moines for this residency, and talk about how we are here to support resident education. UnityPoint Des Moines has a long history of graduate medical education, and adding emergency medicine to the list of programs here was just a logical next step for us. We have all the patient population, the diversity, the subspecialty expertise that you would need to train emergency medicine residents well. But what's unique here is that we don't have a lot of the surgical subspecialty or other subspecialty fellowships that would compete for a lot of the things that we do here in the emergency department. That gives emergency medicine residents the chance to get access to procedures, critically ill patients, off-service rotations. They're going to be the resident oftentimes on that rotation. That's going to provide you with an education that really is second to none when it comes to emergency medicine.
Hi, my name's Nick Kleesner. I'm one of the Associate Program Directors in the Emergency Medicine Residency Training Program and also the Assistant Medical Director on the administrative side. Here in one of our trauma rooms, wanted to talk with you a little bit about the diverse faculty interests that we have and the different niche experiences that you can explore in our program here. We have folks in our group that are involved in different EMS directorships, whether that be with life flight or helicopter service or area ambulance services. We have the medical director of the SWAT team that's involved outside the hospital. There's folks like myself involved in organized medicine through the American College of Emergency Physicians or the Iowa Medical Society, and research opportunities. So I think you'll find training here gives you a lot of opportunities to explore those areas of interest and finding a faculty that can help mentor you in developing that into a career.
Hi, my name is Amanda Coco, and I am the program coordinator for the Iowa Methodist Medical Center Emergency Medicine Residency Program here at UnityPoint Health Des Moines. We are super excited to have a residency program in emergency medicine and have a wonderful home-based space for our residents to come together 24/7, pop up and see our program director, associate program directors, myself, and just have a space for everybody to include conference space as well. We are housed above the emergency department, which is super convenient as well.
I'm Brian Jeanette. I'm one of the Associate Program Directors of the Iowa Methodist Emergency Medicine Residency Program. I'm in our large conference room right now. I wanted to talk to you real quick about the curriculum we've put together. Our didactic curriculum is put together in an 18-month block that goes over the entirety of the core content of emergency medicine. It's put together that way so that all of our residents will have the opportunity to go through all of the core material twice while they're in our program. In addition to our didactic curriculum, we have set aside longitudinal curriculums for specific things within emergency medicine, including ethics, administration, airway management, and we additionally will have time set aside every month at conference for residents to participate in simulation sessions at our new simulation center at Methodist Hospital.
Yeah, hi, I'm Dr. Kim, and I'm one of the core faculty of the residency program and one of the emergency medicine attendings here at UnityPoint Des Moines. I am in charge of the residency wellness curriculum. The entire first month of the residency is an orientation month, And during this month, residents will be able to start the didactic curriculum in terms of emergency medicine knowledge, but also wellness topics will be covered during that month. During that first month, residents will also have opportunity to work several ER shifts, and activities will be planned for them to get to know one another and get to know the city of Des Moines. We have once a year retreat that we plan for the residency class. They get to bond with one another and just take a break from the work that they're doing at the hospital. We want residents to be empowered to lead and be a huge part of the wellness curriculum, and we want them to give input on what they feel will be most useful for them as residents here in Des Moines.
Hi, I'm Dr. Alex Witry. We have a variety of training sites available for residency trainees, providing a unique blend of the unique challenges of different practice settings. Here at Iowa Methodist Medical Center, it's a level 1 trauma center, the only one in central Iowa. We have a full complement of surgical and medical specialties, as well as an excellent state-of-the-art ICU. Our second site would be at Iowa Lutheran, which is a community-based hospital on the east side of Des Moines, and is an important resource for the members of that community. It also hosts our inpatient psychiatric care. Lastly, but certainly not least, we have a third site at Grinnell Hospital, which is a rural hospital. Gives trainees the opportunity to practice in a rural setting and to experience the unique challenges that come along with that. We think that between all of our sites, we have all of the things that a resident needs to become successful and practice in any environment.
Hi, I'm Dr. Tyler Fisher. I am a pediatric emergency medicine physician and one of the core faculty for the emergency medicine residency here at UnityPoint Health Des Moines. The pediatric experiences for the emergency medicine residents take place at Blank Children's Hospital, a tertiary referral center and level 2 pediatric trauma center. Pediatric experiences for the emergency medicine residents take place in the Blank Children's Hospital emergency room, a dedicated pediatric emergency room that is staffed 24/7 by fellowship-trained pediatric emergency medicine physicians. It is the largest volume pediatric ER in the state of Iowa, with approximately 26,000 visits yearly. Residents do 2 dedicated months of pediatric emergency medicine, one in their first year and one in their third year, as well as longitudinal experience throughout their emergency medicine rotation so that they encounter the full seasonality of pediatric pathology.
Hi, I'm Dr. Sexton. I'm one of the core faculty here. I wanted to talk to you about Des Moines as a place to live and work. There's a diverse, thriving community of young professionals throughout Des Moines that has spurred numerous opportunities for new residents to enjoy once they move to town. From the Civic Center to a dozen craft breweries, festivals year-round, a fall marathon, a spring marathon, the state fair, farmers market, upscale restaurants, and collegiate athletics, all within a comprehensive network of biking trails. Our faculty are confident that you're going to find this to be a great area to live and work. We're very excited to have you come experience the area and are excited to have you come work with us.
So I'm Brittany Jensen. I am the EM Clerkship Director, as well as one of the faculty here at UnityPoint Des Moines. Our residents here have ample opportunity to teach. We collaborate with 2 different medical schools here in the area and have pretty consistent medical students from both Des Moines University and the University of Iowa. We also have the occasional out-of-state student who comes into a sub-I here. So we find it very important for our residents to have opportunities to teach, and that is definitely not an issue here. One thing that's unique about our department here is that we have both an academic and community feel, a little bit of a mix, in that similar to an academic program, we have access to all the different specialty consultant services. However, most of those services here do not have residents working with them. So our residents and our students do not have that competition with those other residents that you might in a purely academic program. An example being for ankle reductions, our residents don't have to compete with an ortho resident to do that. We do all of our reductions and therefore are able to provide that hands-on learning and teaching opportunity for both our medical students and our residents. Our faculty here are all very enthusiastic about teaching. I think that's actually one thing that drew most of us here, is the opportunity to practice in a community setting but still be able to teach. We think that is really important. We all value the opportunity to learn by teaching, not just during training, but throughout our careers in emergency medicine.
Thank you for taking the time to get to know us. We hope that you see what an excellent education you'd receive here at UnityPoint, the wonderful family that you would join, and that you'd be prepared for the next step in your career. We hope to see you on the interview trail.